Hello and welcome to Eye Contact. I'm Paul Rosen and today I'm with Professor Mohammed Belmekki from Rabat in Morocco, and we're going to talk about OCT imaging in the cornea. Mohammed, welcome, and it's a great pleasure to be here with you.
Thank you.
Can you tell me how you're using OCT for corneal imaging in your clinic?
Thank you for the invitation. Now OCT is a main instrument used in cornea. I mean, in the past we used Java, we used Placido disc and other device, but now OCT is an instrument which should be used on all cases of corneal disease. Let's take some example. For example, for keratoconus, it's very important for all the cases of keratoconus. It's important to detect early cases, and now we know what is the role of epithelial mapping to detect early keratoconus. Also, it's very important to know what is exactly the pachymetry. Pentacam gives us information of pachymetry, but OCT is more accurate in giving us this information. It's also very important in cross-linking. Before cross-linking, because we know exactly what will be the remaining pachymetry after taking off the epithelium, but also it's very important after cross-linking to show us that we were efficient in our cross-linking with the line, cross-linking line. Also, it's very important when we are using intracorneal rings, because it gives us information we should put our rings and if our rings were very well placed. In corneal graft, it's the most important things for me for OCT, because it gives us information before surgery, because we know if we can go for deep lamellar surgery or penetrating surgery. And also during surgery, it's very important, and we will talk about. Finally, the OCT is very important to follow the keratoconus after corneal graft. Apart from keratoconus, all the other diseases are can be checked by OCT. Let's take some other example. For example, for corneal ulcer, we use slit lamp to follow this patient, but when we follow them with OCT, it's very easy to know if we are progressing or not. Other things for corneal dystrophy, congenital corneal dystrophy, we know the new classification, and OCT is very important to establish if it's stroma or epithelium or endothelium which is involved. So OCT is very important on all the diseases of cornea.
And how does OCT fit in with other diagnostic modalities that you use in evaluating patients? I'm thinking there's Pentacam, there's Aura and Corvis ST. And it might be helpful to explain to the listeners what Aura and Corvis ST are.
Yeah, it's different instruments. For example, Aura and Corvis, they are giving us information about biomechanics of the cornea, where OCT is giving us information about, near histological of the cornea. So it's anatomy and something like function. So combining both of these, the device will give us more information to understand, for example, the behavior of cornea after refractive surgery, or to understand if there is first cornea, keratoconus.
And do you use Pentacam still, or do you think?
Yes, we use Pentacam. It's a good tool to use it until now, and we see that there is now devices combining both of the technology, which will also improve our knowledge about cornea. So this is the evolution of things. We, as I told, we start by Java, but now we are on the combination between OCT and Pentacam. Yeah.
And it must have changed your practice quite a bit, I would have thought. In what way?
Yes, it will change our practice. It will change our strategy, for example, for treatment. If we have more information about what is going on inside the cornea, it will help us to make the best decision. So, for example, for lamellar surgery, OCT before surgery is very important, and we have to study the cornea very well to know where to put, for example, our needle if we want to do a big bubble. Okay. So we are not going to put it in the thinnest places. Pentacam is not much accurate like OCT in this kind, yeah.
Okay. Yeah. And are you using it intraoperatively?
I'm not use it routinely intraoperatively, but I have the experience to see this, and I can tell you that it's very useful for the surgeon. It's give us a lot of information on all kind of corneal surgery. I mean, for example, let's come back to keratoconus for deep lamellar anterior lamellar surgery. It gives us the information where to put our needle, but we should know that all the instruments now are metal, and this give a lot of shadow during surgery. So we have to take off all the instruments out of the area of surgery, time to time during surgery, just to understand what is happening. But I think things will more developed. The only problem with this device is too expensive. So maybe if it come less, it will be more used in surgery.
Do you think it slows down your surgery?
It will be used. I mean, think for sure OCT will be a part of all the operating room in the coming years. But it's time of the device should develop, because it's not very accurate, and also it should be less costing, because it's really now it's very costing. Yeah,
okay.
yeah.
Very good.
Yeah.
Mohammed, thank you very much for joining us, and it's a great pleasure for us to be here.
Thanks to you.
For more information, as always, visit us at eurotimes.org. Thank you.